We made it another week. Well, there's exciting things that I want to share with you today related to Gait and Pediatric Gate VR app, and some of the interesting new e-learning components that James and I and Chris as well, we're kind of going through and trying to make sure that it fits that stage of student learning. But I'll show you glimpses of it, and I'll be very curious of your thoughts and your comments. So I love meeting with faculty on all of these webinars. Please feel free, as I think of these as really idea breeding grounds. All of us are thinking about probably similar ways of teaching and also some unique ways. So I always think of this as a great opportunity for faculty to share little things that they've seen that really work. And my job is to share a little bit about our apps, and also to kind of share how we're envisioning a lot of these things being used, or how we're using it in our classroom. So it can expand your own thinking about how can I use this new resource. Just to introduce two of the team here, Chris Schmidt is actually director of our athletic training program at Azusa Pacific, and he is part of the PhysioU team, ATU team, as well as James Sims, who taught Gait to me when he was teaching at Loma Linda, and is now an integral part of going through every single simulation in every single game. He is the jack of all trades. He can look through simulations related to cardiopulm, pediatrics, Gait. He can do it all. And so it's a unique opportunity to have James with us today.
You forgot to mention, Mike, that I taught you Gait when rocks were soft. It was that far back. So
yes,
we still had finger shadows instead of videos to go by.
Yeah, exactly.
Sorry.
Yeah.
Bad jokes.
So, oops, let me go back here. I don't know what happened to my little PowerPoint. It's taking on a mind of its own. Okay, so, and just so that you know, I have been building PhysioU for the last 7 years. And all of it has been a journey of trying to solve problems that I saw in the classroom, including the problems that my colleagues have shared with me. And so I hope you each consider me as a colleague. And as you begin to see issues or things that you've always dreamt of building, we now have the ability to build most things. So feel free at any time if you have thoughts, ideas, share it, reach out. These are wonderful opportunities for us to create and really push learning to a new level. And just as importantly, beyond pushing learning to the new level, I think whenever we can help make a faculty's life a little bit easier, because we all work a little too hard, are asked to do a few too many things, that is also one of my goals. That's why all of these webinars are fully directed to and created for faculty. So I've been teaching at Azusa Pacific University for about 20 years now. And as you can see, we were asking the question. In fact, the Gait app is one of the apps we built almost 5 years ago, because I remember learning Gait, and nothing against you, James. I mean, rocks were soft then, but it was so hard to connect the dots between looking at a stick figure on page 12 and then looking at graphs of EMG activity isolated from the stick figures on page 25, and then trying to make sense of the range of motion graphs. Like, there's so many disconnected concepts that by the time all those things were delivered, I was just a little bit of a jumbled mess. And so, Chris and I, one of our professors also at APU who teaches Gait, I said to Chris, hey, Chris, there's got to be a better way. I bet we can put information together so that anytime you're looking at range of motion graphs, you have an image of that phase of Gait, so the students can give meaning to that graph. And so we'll talk a little bit about that. Those were a couple of things that really I thought, if we're going to teach people how to analyze movement, if we are the movement specialist, we can do a better job of providing high quality videos that are from multiple views, just like we would learn and view from the clinic. And also videos of pathologic gait, prosthetic gait. We should be able to curate all of that instead of floating around YouTube and hoping that next year those videos will still be there. That cannot be an efficient way to live my life. So Chris and I basically sat down and said, hey, I think I have some ideas. Let's see if we can build it. So I'm going to show you that in just, actually, I'm going to take a moment to show you that right now. So when you go to the PhysioU web app, and I hope all of you know that all faculty have access to this app. You do not need to pay anything. We built this for you. We built this to elevate education worldwide. When you sign in, you'll see that I'm always logged in. Every time I start class, I've got PhysioU up because there are little things that normally I would just say, and I hope that the students could catch it out of the air, that I slow down and oftentimes will pull it out of the app. So I'm talking about a technique that they learned last week, or I'm talking about a range of motion MMT skill that they learned 2 semesters ago. I actually slow things down, take them directly to the app, and then when I'm talking about it, I show them, I bring the picture up for 2 reasons. One, the image makes some kind of connection in their mind to past learned knowledge. This is not just air traffic of my voice and the things I'm saying flying through the air. I like to pause and anchor the things that I say. The second thing is when you open the apps and show them how you navigate it to illustrate your point, they again remember that this resource is in their pocket. I'll tell you for, I think it was it Tracy or Lisa, when the students are out in the clinic, this resource becomes even more powerful because they now have all the resources that they learned with in the classroom. It's in their pocket, and you showed them repetitively in the classroom how to access the content. So if I take you to the Gait app, so we sort the apps now because there's just too many. We sort it under the fundamental skills. So you can see here that the Gait app is right here. And Chris and I decided that as cool as videos are, in the beginning of learning human movement, pictures should always, the imagery associated with the learn phase should always be static. So you'll see that we've taken the image, we've highlighted the reference limb, we've made it very easy for students to associate different data points. So you've got here the phase description, you've got range of motion requirements. Let me squeeze that in a little bit. Here's your range of motion. Remember what I said about, imagine if you just cover this image and you stared at that graph. Would that graph mean anything to you? But if you look at the graph and you go, oh, we are at the phase of initial contact. In that phase, there is 20 degrees of hip flexion, and I can anchor that data point to what I'm visually analyzing. You've just taken a step in the right direction of creating a movement analysis expert. And so you're like, oh, look, it's flexion 5 degrees. The knee is not fully flexed or fully extended at initial contact. There's so many conversations that we're about to have about why that's the case. And dorsiflexion, 0 degrees. So if you just think about how simply these images make meaning of these graphs and what that means to student learning, you'll begin to see why we built this. So here at initial contact, you can see tib anterior has some work to do. And I'll ask the students, hey, if the tib anterior cannot fire, what do you think is going to happen to this foot when it hits the ground? And I'm hoping that some in the class will go, oh, that's why people have foot slap, right? So you can have all of these different little opportunities because you have a base on which to build context on. And then here is your critical events. Okay, and further down on the page here, you'll see that in the critical events, we've tried our best to kind of match the language from various resources so that there is very little confusion, even if different faculty are using different resources for this class. Okay, so as you're moving through the different phases of gait, I can move over to terminal stance here. Just give it a second to load. I'm not sure why my internet's so slow. Here is my critical events for terminal stance. Here is my EMG activity. Here is my range of motion requirements. And here is the phase description. So one suggestion for you is that this section of Learn, actually students can go and begin to pre-study it before they come to the first day of gait class. In fact, what you can do in the Learn phase, if you go right here, if you open the sidebar, you can just copy this page title with link. And you can dump that into your syllabus. It's a link that the students will actually, if I go here and I open a document to represent our lab handouts, you'll see that, or syllabus, when I paste that, here's the phases. So you can say in your handout, please view the following. And you can just cut that in. When the students click on that, it takes them directly to this Learn phase, and they're going to learn about each phase. So they can explore on their own. Later, I'll show you our next big idea on how to make that early learning process engaging and actually accessible. So here, beyond Learn, you have Analyze. Analyze is now an opportunity to bring normal gait into your classroom. Here is side regular speed. You can always expand that if you want to. Here is side view slow motion. So when we come to class, now that they've already gone through the Learn phase, you can stop the video at any point in time and ask them, what phase is this? What range of motion requirement is going on here? What muscle activity? What are the critical events? This is a platform that you don't have to worry about because it's always there, that you can build an interactive classroom upon, right? Not having to find videos in your Google Drive, not having to shuffle through videos or go to YouTube and hope that there's videos there or wait for an ad to play. Those are all elements that I think create distraction and cognitive load on the student. This is all here. You can craft your magic of how you want to interact with a student here. And here is your range of motion graph. We captured this in our movement lab. You can stop the video at any point in time. You're like, guys, what phase of gait is that? What range of motion is occurring at the hip, the knee, and the ankle and foot? All of that is here on the graph. So think about how engaging that can be, and also how that helps the student apply that knowledge base. Here is EMG. I'll make that a little bit bigger here. Patients in swing, the anterior tib's working hard, the foot's on the ground, and the anterior tib quiets down. There's so many stories to tell that are so difficult to tell when you're looking at static bar graphs. So that's an example of how we use normal. Normal is actually the application of all the things that they had prepared for in class. You know, they prepared before class in the Learn phase. In Analyze, we also decided to try to film deviations on real patients. So let me give you a few different examples. So here's excessive hip abduction. So you can see we sorted the deviations by body region, which is how we teach it often. And now you can ask the students, hey, so when you look at this, what do you see? What might be impaired? What phase of gait is this particular deviation or movement fault in? And here are the answers: associated phase, potential cause. I think this is really valuable. So first, when we're watching it, we talk about what are some things that might not be going right. Then we solidify that by talking about it. And I ask them often, because they've learned range of motion MMT by this point, or at least it's kind of taught around the same time. I'll ask them, hey, how would you measure that? If you suspect hip and knee flexion are limited, where are your goniometer landmarks, right? I may not remember perfectly, and I will go directly to the app and verify what they tell me. So we'll go, oh, there's hip. range of motion, flexion. Here's our landmarks. Fantastic, guys. Good call. That's what we learned last week. So another piece of the value is that you have this resource. It's not a textbook that's on their shelf that you have to pull out. You can jump around from app to app to help them re-access previously learned knowledge. So I do this all the time. In my ortho class, I'm back to range of motion MMT app. In my ortho class, I'm back to modalities app because it's so easy for me just to jump around. James.
Yeah, you know, and I mean, I practice what I preach. In the last 3 days, I've been reviewing neural simulations, and I had to go back and look up the gait. Like, so in the more frequent you go back to the PhysioU apps, the more frequent the students and more familiarity the students will have with it. And so like looking up so in a neural class, you might say, okay, we're doing gait analysis here. What are the critical events? And the question I had to look up was regarding swing phase and what are the critical events? And is it the knee or the hip that becomes more critical if they have the extensor tone? Hip 15 degrees in pre-swing versus 40 degrees knee flexion. Initial swing 60 degrees knee flexion, still only 15 degrees hip flexion. So I was able to go back and I just went on this app and looked it back up because, you know, I didn't memorize it. I once you see it, you remember very quickly. So I think it's very useful to go back and continually use this app because the more frequent the students do it, the more familiarity they'll get with it. And the clinic, bam, they can find the information real quick. And so it could be a neural clinic, a fill, or neural class that they go back and look at this foundational information stuff and they know where to find it very quickly.
Yep, absolutely. So you can see we have neurologic patients, we have orthopedic patients. Here's a patient with significant knee osteoarthritis and her varus gait. We captured it. How do you describe that without good video? But now you have videos of all of these common things. Here is a patient with insufficient knee extension, right? So am I freezing up, James, a little bit? There we go. Okay, so what you can see is we have created a collection of a lot of these neurologic and orthopedic gait deviations. And we've also tried to add in some prosthetic gait deviations as well. So here's prosthetic gait. Hey, James, do you mind letting me know, can you hear me or am I freezing?
Yeah, no, the video, I just typed in the chat, the video hesitated and not for very long, but your voice kept coming. So
okay, good.
Yeah, so your narrative was good.
So we asked a couple of professors actually who teach prosthetics to come in and help us film all the prosthetic gait deviations. So if you think about here, knee instability, he basically took the battery out of his knee so that we'd be able to show students what does that look like, right? It's not that the students necessarily are going to fix this problem, but it's useful for them to begin to recognize these different patterns, think again about the associated phase, think about what are some potential causes so that they can be part of an interdisciplinary team, and then what the penalty is. Let me give you another example here under transtibial. And I'm going to go for, let's see. We can take a look at knee instability here, or let me see. Oh, pistoning is one that I like a lot. So eventually the students are like, well, something doesn't quite look right. And then we can talk a bit about what pistoning is. Why would someone look like this when they're moving? And here are some potential issues. So now, along with the basic, the basic skill of talking about these different types of patients and the different gait deviations, I think there's this important conversation, and that is always helping the students take that half step forward, which means when you look at a particular deviation, it's very helpful to have students think through what is it that may be the cause and how would I go about assessing for that impairment. Many times I'll even ask them to make the leap. If you think that this patient does not have enough muscle power, what are some things that you have seen in the past or you think that we could do to try to improve that muscle power? If they say something as simple as strengthening, I am pleased. They're making a connection between movement analysis, predicted impairment, and then the appropriate intervention. That connection is so valuable. I don't think we should wait until they finally learn all the skills to do that in TheraX and in ortho and in neuro. So we often will have those kinds of conversations where I'm like, hey, the patient has very limited hip flexion range of motion. So if that's the case, what are some things you can think of to do that you've seen in the clinic or that you've learned before? Oh, we should mob it. We should stretch it, right? Those little conversations create the half step that basically prevents this information that they're learning at this moment from being siloed, right? Because we know lots of times in a range of motion MMT class, in a gait class, they learn about all of these deviations, they can recognize them, and they have no idea what it means. They have no idea what it relates to and how it eventually connects to treatment. So I think having this all here for you gives you the opportunity to have those conversations, because you don't need to worry about finding the videos, making sure finding the videos in your folders. So those are just a couple of thoughts. When it comes to a very big and messy class like ortho, it is such a relief for me when I'm trying to illustrate ideas, make connections between examination and treatment, to have all of those things that I can just click through. Because just telling the students and hoping they can imagine or keep up with what I'm saying, I guarantee you it's very difficult for the students. So this becomes a visual roadmap or a building block upon which you can build clinical reasoning. The last thing I would say for this app is that Chris and I built case studies. The case studies will include athletic, sport injury type patients. This information down here, we know that this is a year 1 class. So all this information is put there and it's simple enough for any PT student to read through, right? I can understand what all of this is. I don't exactly know what to do with all of it, but it's my half step. Remember, I'm going to teach them all of this in ortho, but I'm going to introduce it in year 1 because I'm putting some bookmarks. I'm giving myself a platform to expand their brain. And I'm using gait and I'm helping them apply gait to this development of their clinical reasoning. So here's some aggravating factors. If I read that, even though I've never heard of that before, I can understand what that means. So we build some questions. So we tell the students, all right, guys, everybody break into groups of 2s or 3s. We're going to do case study 1, 20-year-old female with severe right tibial pain. You guys will do your gait analysis. We'll look at her from the side. And I want you to read a little bit through the case so that you're able to begin to form a clinical pattern. Because I think developing clinical patterns is really valuable, especially as they move into some of the more clinical courses. So by the time they're done reading all of this and they've gone through these questions, what do you note about her overall gait pattern? Now, we tell them not to look at the answers. Their job is just discuss and develop their clinical reasoning and their observational skills. The faculty member is now able to, while these guys are discussing, take a quick look at all the answers and formulate your discussion. Because I think the power of this is that as they've put their money on the table, so to speak, these are my thoughts. This is what I saw. It's so important for the faculty member now to lead that discussion, add some color to that narrative, and you'll be shocked at how quickly the students thinking can come online, can come in line with yours. So what deviations do you note at the ankle joint? What are some joint muscle tightnesses that may be contributing to her symptoms? What are some functional activities that may be aggravating her pain? So we get to talk a little bit about medial tibial stress syndrome, right? So something that could be very dry sometimes, like gait, when you throw in a case, you rein the students back in. You bring them in and say, yes, this is why you're learning this stuff, because it's related to all kinds of common things that you've heard of or seen of before. So you've got a number of different case studies. You've got case studies related to these residual limb issues, right? You've got case studies related to, let me find another one. Some are related to spinal stenosis. Some are related to stroke. So now what you've done is you've taken the generic gait class and you've made it relevant to all of these other classes that they're about to learn from. So let me just pause for a second and ask if there are any questions about this part of the Gait app, or if you've used the Gait app before, any thoughts on things that you've tried? Any ideas that have come up in your mind? Let me just pause for a second and see if there's any comments or thoughts.
Do you have neurological cases such as stroke or CP?
Yes, in fact, we do. When you look back to here, let me go back to the app. So here is a case for stroke.
Okay. Great. Okay.
So it's a very simplified case because they haven't done neuro yet. This is year one, but there's enough information there. They're like, oh, that's the kind of things that a patient with stroke complains about.
Okay.
You know, all of those are useful, I think, as in the kind of early formative phase. You don't want to overwhelm them, but you want to give them, it's kind of like playing doctor, you know, and you kind of want to give them that opportunity to apply this gait analysis skills in these various settings, because what it does is, I think what it does is it stretches their brain a little bit. And it allows them, when they finally get to neuro class or to ortho class, they've already heard about aggravating factors and age and occupation and all of these different things. So I think of it as graded exposure, just multiple little ways to get the student to kind of stretch their brain and prepare for actually future material while applying the material that they're currently learning. Let me see. I think there is, let's see, this is a 56-year-old male. He has a spinal cord injury. There is another one, I believe. He has Parkinson's. And so you have a few, you know, that you can actually, let's take a look at him from the front. Yeah, so I hope that that helps with your being able to apply this across the board. And, you know, you're not going to have enough time to go through all of these. I think you can pick and choose which ones you want to use. And you can definitely invite students, right? You can take any of these cases. This is 71-year-old male. You can say, guys, I've put this case into your syllabus. I want you guys to meet as a group, and I want you to do this case, and we're going to discuss it when we come into class the next day.
Okay, great. Or we could put that in Canvas or Blackboard as well, probably.
That's right.
Okay, perfect.
Yep. So again, it's hard for people to remember where that is, but in this little sidebar, there's an educator resource. It allows you to copy page title with link, in which that's what I did here, as I just Command V, I pasted. And you can also make that even nicer, where if you go here and you copy thumbnail image, now you can just add an image as well. So for almost all the apps, oh, let me think. Oh, this captured where his knee pain is at. So right-sided knee pain. So many of our other techniques, if you look at the neuro exam app, for example, you'll see that any technique that you want to show, let me give you an example of that. Neuro exam, balance, Romberg. copy page title with link. So here is my Romberg, and then here is my image. So there is a representative image. This is how I've augmented all my lab handouts, is there's always a link and a picture, because I think that kind of visual association helps with student learning. Okay, other comments or thoughts?
Mike, I have some comments if.
Sure, please.
Yeah, I think the Gait app is such a landmark app, because once the students learn the basic training, the range of motion, manual muscle test and stuff, and then they get the basic, phases and stuff of gait, it's a great tool to teach them how to think. It's the old give a man a fish, you feed him for a day, you teach him how to fish, you feed him for a lifetime. And so you can use this orthopedically if they have a structural limitation, range of motion is limited, they're not going to have dorsiflexion in terminal stance. What can happen? What are the consequences of that? And from ortho, your stroke victims, what type of gait maladies is typical of that? And they can't get out of that extensor pattern. They're supposed to get 60 degrees of knee flexion. They can't get there. So they have a neurological etiology to a gait problem. You got to check their range of motion still. They better have 60 degrees or 40 degrees of knee flexion first. Guillain-Barré, all the way to like plantar fasciitis because of lack of dorsiflexion. So they got more pressure. They have early heel off. They got more pressure in metatarsal heads. And so really you teach them how to think backwards. The answer is metatarsalgia. Why'd they get it? What would you see in gait probably? So you could walk them through the thinking process and teach them how to process information and think, not just memorize information. So I think that's where this gait thing, and if they're wrong, you don't hurt anybody. I mean, it's like, no, it's not that. So it's not like they're doing a mechanic, like a joint mobility assessment, and all of a sudden they do it too aggressively and they hurt their lab partner. It's just observation. So you can kind of have a lot of discussions with these folks. So I think it's a landmark to get them to start thinking through stuff. And you mentioned that, Mike, in your presentation already.
I would also say this idea of this, the sage on the stage beside versus the guide on the side. When you have this type of resource, right, you can pick up any video you want from a click. It frees your mind to craft their mind. It actually gives you the runway to not worry about where am I going to find this video? Oh, I got to click through here and click through there. Oh, it's in this folder. Oh, it's not playing. Now you have a platform that you can always, the platform that you can depend upon, and it gives you the freedom to think about how do I help them think. So it really ties into what you're saying, James, is when you provide the basic tool set for instructors to do their magic, then they can really hone the craft of teaching, of slowing things down. You're not always just caught up in information delivery, right? This does two things, I think. One, it gives you as a faculty member the hammer, the nails, the saw, the tools of your trade are now available, reliable, and high quality. The second part is it allows you to now spend some of that time showing the students how to become a specialist, how to become a clinician. That's where it's so valuable for a clinical specialist, an instructor, to be able to have the platform to help tease their brains and help them connect to all of these, all of the dots along the way. Observe the deviation, decide what kind of impairments may drive the deviation. Talk about a patient you saw in the clinic and how you manage that gait deviation. You have just increased the trust of the student in you as their leader and as their teacher. I'll tell you, all of those elements are so important when we're training students, and especially when we have opportunities to train them over multiple semesters. They need to believe in you. They need to believe that you are the expert. These are opportunities to do that. Let me show you here. Let me take you to, let me share screen a different way here so I can jump around. So here in the Pediatric Gate VR component, so let me click to the next slide here. So this actually was filmed about 3 weeks ago in our pediatric class. So the instructor says, I know the students have learned gait, but now I want them to develop some clinical reasoning and apply their gait analysis skills using the Pediatric Gate VR app. So let me take you there for a second. Let me go out of this. Stop share. Let me go to my screen and go back to the app. Where's my app? Here it is. Okay. So when you go to Pediatric Gate VR, so I'm going to go back to fundamentals. Actually, I'm going to go to PEDS here. Pediatric Gate VR. You'll see that this app was built in partnership with the University of Idaho and also Dr. Edie Kendall. She basically started capturing children in her motion lab that have different types of conditions. So I forgot, one of you had asked about maybe cerebral palsy or some of these neurologic conditions. So this instructor was using this in class. I enter my name, and then she would tell the group, guys, pair up. Everybody can be on their own device. We're going to select Sarah. We're going to work on Sarah first. You can look at the history. So Sarah, I know this is small, so let me read it to you. Sarah is an 8-year-old girl with the diagnosis of right spastic hemiplegic cerebral palsy. She has been in PT since the NICU, seen in EI and the school system. She is coming into your outpatient clinic today for a gait assessment and recommendations for orthoses. You decide you are going to perform the EVGS for her right side as a baseline for comparison. So that's the Edinburgh Visual Gait Scale or score. So here, the entire Edinburgh, we reached out to the authors and they said, we love the idea that you're building this into an interactive tool. So the entire tool is now here. So as the students go through, and let me go here, I want to show you that when students don't know how to interpret what they're looking for, the little description from the study is actually here. So let me close that back and try to get this going. Oh, close that. This is the patient. You can switch from patient to patient. And there we go. Go a little bit further down. I'm not sure why my internet's a little bit slow today. Let me see if I can get her to start going. Reload that.
Looked like there's a little bit of motion, Mike, but it was
Yeah,
kind of oscillating back and forth. Yeah.
yeah. So let me go back and select the patient. Okay. Sarah. Now their ability as they watch this gait pattern. Oh, I know why. Let me make this a little bit smaller here. There we go. So the cool part about this is the question is there initial contact in stance, right? Is what in initial contact, is there heel contact, flat foot, or toe contact? The students can actually use their arrow keys and rotate around the patient as though we were in the clinic. So I noticed that it's a toe contact. So I'm going to click that and move forward. What about heel lift in stance? So I want to go back. Clearly, there is no heel contact. And so I'm going to click that and move on. And as they move through the whole game, what Edie has done is she has scored it. As an expert, she has scored it. When the students are done making these observations, so what is the maximum ankle dorsiflexion? So I'm going to stop this patient for a second. This is in stance. So I'm going to go here and I'm going to move her back a little bit. Move her up a little bit. Right there. Okay. And then I'm going to rotate around and try to measure her dorsiflexion using the goniometer. So here, the students will be able to use that to make their measurement and make their reading. So whatever they end up choosing will end up getting scored, and they will be able to compare their score. So it comes up as a table at the very end. So I'm going to just shoot through this. There is also the ability to apply a posture grid. So there's lots of different ways to play with this tool and allow the students to kind of, apply their knowledge. So as you continue through here, I'm just going to click through a few of these to show you peak knee extension during stance, terminal swing knee position. And let me go to the end here. So it's pretty extensive, which gives the students actually, I think, slightly different from how we taught them in the gait class, which is usually from the Rancho and Perry book. This has a very systematic step-by-step process. And here is the student score. Here is the assessment scored by the instructor. And then the students can go in and look again at the things that they didn't quite get right. So now you have this feedback mechanism. And remember, all of this is asynchronous. You could do this in class as a classroom interactive activity. You could send them home and have them do this as part of their practice. And let me squeeze this back down a little bit. We can select a new patient. So I can go Austin, and we can look at Austin here. Austin, 12-year-old boy, struggles with motor coordination and met his motor milestones later than most children. He decided to go out for soccer this year, and his coach noticed that he displayed an in-toed foot position. His parents brought him to PT in an attempt to improve his lower extremity alignment, to prevent injuries and make his walking and running more efficient. Please use the Edinburgh and do your assessment. So if I go back here, the students now have different opportunities to observe, to go through the gait analysis tool and really apply their knowledge. So that's how we are using this. It's an opportunity to help students visualize different gait patterns in pediatric patients. It's an opportunity for the faculty member to actually build upon what the students are seeing in the movement analysis here as they're talking in the pediatric class. And it gives you the option to create like this interaction in the classroom. The students loved it. It just gave, everyone took a break and they played games for a little while and got smarter from it. The last thing I want to show you, actually, let me just take a moment here and ask, are there any questions about this? Any thoughts, comments?
I have a comment for you, Mike.
Sure.
In using this, do you kind of fall behind the lab because the kids are so engrossed in it? It's like, next thing you know, it's like, oh my gosh, I've been doing this for 20 minutes. And, I can see them just getting kind of engrossed in this, that they forget the track of time and go, oh my gosh, it's almost a good problem to have, that they're so engaged, kind of be pretty cool.
Yeah, I think what this does is, so you imagine our pediatric class goes from 1 to 5. Well, either way, our classes are always in 4-hour blocks. These are what we call these intermissions, where they're taking a break from the lecture. They're taking a break and they're interacting with the material. And I think long-term learning, there needs to be, like we all know that we need to switch it up every 20 or 30 minutes so that the students can have a break and apply some knowledge and have some fun while they're learning. So I think of using this as one of those tools. Like, how often do you get to say, guys, we're going to go play, and by the way, you're going to get smarter from it?
I imagine you have like a group of 4 or 3 of them around one computer kind of talking, and they're all kind of cohort collegially learning. It's pretty cool.
Yeah, if you see this short little clip here, you will see that they're all paired up. So they're talking to one another. Hey, do you see this? What do you think about that? Right? So they're discussing it, they're playing with it, and then they're making their own decisions. That's the other thing that I like about this. The problem with just putting up a video of a gait pattern on the screen is that there isn't the opportunity for every single student to make a decision. It's often the 5 same people who bring up what they see. When you create this opportunity with the Gate VR app, everyone is asked to make an analysis, make a decision. And I think that's useful. All right, other comments? Okay, let me show you the last thing. Let me go back and share screen one more time. I want to show you what James, in fact, this is really James's baby because James is a gait specialist and taught gait for many years. So we have created another e-learning game. The goal of the e-learning game is that students could come in here and play to learn, define the terms of gait, identify the basic components of the gait cycle, including phases, critical events, and range of motion requirements. So the students will come in here. Our goal, actually, what we'll do, this class is already just finished, but next year when we start this class again, the instructor will invite the students to go through the learn phase of the app and then to come in here and play, right? So there will be different little questions, right? Here is the gait cycle. The red colored limb, what is that, right? So, and all of the answers have an explanation. So as the students play through all of this, let's see, what phase is this in gait, right? So this is probably, I'm gonna go here. Correct, this is the stance phase of gait. So essentially my thought is when the students are done playing with learn, they will have enough knowledge to now go and play through the gait fundamentals game. When the students are done, you can see James here making all the comments as we're continuing to refine it and build it. When they are done playing the game, they actually come to lecture fully prepared for you to tell stories, to build the clinical reasoning, and to actually teach your class. Think about how much more prepared and efficient the learning is going to be now that they've been able to play through learn, play through this game, and submit their learning report. And what I mean by that is for any one of our simulations, so I'm going to go back to show you, for any one of our simulations or games, let's go to range of motion. When the students complete the game, there's a learning report. You will know how many times they played it, how much time they spent on it, what their scores are, because they will turn this in for a few points, right? So I tell the students, you can play the game as much as you like. I built these to be fun, low risk, formative, asynchronous, because I think that's what students need to learn. I don't think learning is about information delivery and testing, I think it's pre-learning, information delivery by the professor so that there's increased resolution, there's more narrative, right? There's more clinical reasoning in the guide by the side model. And then there's all of these little games, right, that help them to play out their knowledge, allow them to apply their knowledge. So I just tell them, hey, I take the highest score that you're going to get. You can play it as many times as you like, because by playing, you're going to learn, right? So this is a record of my playing of this particular game. They will be able to send that to you as well as a form of homework and as a form of pre-learning. So just so you know, James is working closely with our team to finish building this. And then soon it will show up right here in purple. All of our e-learning components, all of our games and simulations, you're just going to see a gate icon and it's going to be purple. When they click on it, it's going to take you to this game. And essentially you can, just like any one of our simulations, you can take, I'm going to go to wound care game. You can click on the game, go to the sidebar, copy page title with link, and dump it right into your syllabus, right? And now the students know that this needs to be done and turned in before I come to class. They just start their game. So I hope that's useful for you. And I'm curious now, any thoughts that have come up in your mind about the PhysioU Gait app, the Gate VR app? Yeah, any comments or thoughts?
There's a question in the chat, Mike, from Sam. If
Oh,
you look at and address it real quick.
yeah. So Sam, when you look in the app itself, the Pediatric Gate app, there are instructions to use the arrow keys. So you use the arrow keys to zoom in, to zoom out, as well as to rotate around the patient. So let me go there real quick. Here is Mike. Here is Kimberly. And Kimberly's going to start walking. You can see here, zoom in, zoom out, turn left, turn right. So I can zoom in. I can rotate around, and I'm just using the arrow keys. And part of this is also, to address the accessibility issues. So that's how that works, Sam. Other comments? Yeah.
It was funny, Mike, because when you're doing the range of motion on Goni, I go, wait, her leg's on the other side. We can't see it. And you just automatically whoop, did 360 on her, or 180. It was pretty cool for you to see you do that.
Yep. Other comments or questions? Ideas, thoughts?
I was just gonna say, I love the pediatric content, and I know our students do too. And my request would be for more pediatric content, just because that's my bias.
Yeah.
I've often thought it would be cool to have a platform like this for assessment tools, so students could be interactive in, going through the bot or the P-body and saying like, well, what would you give this child? What score would you give them? We bring kids into our lab, but they're in groups, right? So a lot of groups get typical kids, and I just think like that would kind of be really cool. Maybe like for DME equipment too, like would you put this child in an AFO or a ground reaction AFO, or thought processes. I think there's a lot of possibilities, and I think it's really, really cool. Our students love PhysioU, so thank you.
Yeah, absolutely. And I'm just showing you here in the developmental milestones app, our first round of creating exactly what you're saying was done here. These are just short pieces of the bot 2 because you only have so much time in class. And we asked the students, so we create a link.
Until I say stop. Ready, go.
So we have a collection of this along with, just a short piece where we're asking students, hey, by the way, could you score this? And here is the instructor's score compared to your score. And it becomes a platform for education. I will tell you that in the studio, we recently filmed a full P-body and a full bot 2, as well as, I believe, a torticollis eval that will be turning into these types of simulations. So I'm right in line with you. I think the next big evolution of our education system will be built around interactive learning like this, low risk interactive learning where we can create clinical scenarios where students can really evolve and develop into clinicians in a relatively controlled and low risk environment. So we're spending tons of time and energy thinking that through. I would love to chat with you, Lisa, more about that. I think the challenge that we see is, one, most of these tools are proprietary. So there's a little bit of tiptoeing around that. But I don't think filming this child doing those tasks is necessarily the issue. Probably most programs have samples or copies that students temporarily use. In our apps, what we've done is we've directed them to the website where they can buy the tool. We've directed them to SRA labs so that they can look at the most recent and updated information related to the tool. And then we create little snippets where they can apply the tool. Because I think also in talking with the PEDS instructor, she's like, one of the students often say, I'm confused. I don't have enough time in life to complete a full P-body or bot 2. But she's like, that's the point, is that we need to be able to give them opportunities to look at the patient and say, I probably should test this, this, and this based on what the parents are complaining about or requesting. So I think there's all of that such critical development of their clinical reasoning, but it really would be ideally built around a patient video, right? Or a series of little patient clips.
I think, Lisa, the best thing you take home is that you as the instructor, it's so cool because the foundation stuff they can learn, that's pretty low level learning, and it's not a learn and burn, it's a learn and now apply, a learn and understand that, and you get to do that learning and understanding part with them. And God forbid we make learning fun for them. I mean, that's the fundamental stuff that, you know, that make those games at the beginning for the gate, because, you know, it's fundamental with that with emphasis on fun for the students, and they get engaged more. They're more interested. I wonder how many pediatric physical therapists we're going to be making because they love the Pediatric Gate app and go, this is cool. I like working with kids. Boom. You know, and so rewarding for you as the instructor, as a teacher, that you're not bothered with just the minuscule things of like looking for a video. And that's what sold me on it. I had looked for a video. Next year, the dang thing's gone off of YouTube. Where the hell did it go? Now I don't have to worry about it. I know next year I got my videos ready to go, and I can just add more to it as I kind of develop it for the students, and it makes learning fun, not only for the student, but also for me.
Yeah. Other comments, ideas, thoughts? Related to the Gate app, the Pediatric Gate VR app, or ideas of things that you might want us to try to add? Anything? Any thoughts? Okay, so I just want to close out by saying, you know, next week, man, are we into May already? Where's the line? We are doing neuro exam. We're talking a bunch of neuro simulations. So for all the neuro instructors that are there, feel free to join us. And I think, James, I don't know whether you've cut a meeting link for me.
I've done it. I've done it at the beginning, and now I was ready to reiterate that, especially this stuff. I mean, this stuff might need your, with all due respect, a little hand holding as you walk through what's all out there for the gate and the Edinburgh gate thing, you know. So please, I have on their contact information for Mike. You can schedule an appointment and stuff like that to, you know, and it's kind of like, how do you eat a whale one bite at a time? So just get one bite at a time, use a little bit of the gate app and a little bit more. And as you get better at it, you'll get better at it.
Yeah, I hope that this time has been useful for you, and I'm excited anytime if you ever have ideas or questions or want to learn more about some of the apps that are tied to your content area, you can always feel free to just book me through my little meeting link. And it's always a thrill to connect with faculty and to really elevate teaching and learning together.
Mike, we got another request from, and this is from we had a previous webinar a couple weeks ago or last week about videos after the 12-month process of motor, of motor acquisition for folks after a 12-month age, you know, from 15 to 24, and then also all the way up through adolescent, you know, what's adolescent motor control, when the kids start being able to balance on one leg, and all the way from like physical education through the primary grades.
Yeah, absolutely. When it comes to the pediatric app, right now what we're filming is pediatric interventions. We are filming it with a PT and an OT. So there's a lot of interprofessional stuff that I think is really cool. We have also created, we are in the process of, we filmed, but we're now creating a interprofessional PT, OT, and speech pediatric intervention on a patient. And so that will be probably sometime in late 2022. But the pediatric interventions, I've already talked to Melissa. She's like, we're going to start bringing in some older kids and capture some key things for older kids. So all of those comments are absolutely, I hear them, and we're working our hardest to try to continue to evolve the content. And I just wanted to say, we really appreciate faculty who bring up these ideas, who have the students subscribe to this, because this is how we pay patients. This is how we pay for a studio. That's how we pay programmers to build all of these things. And we're especially sensitive to the debt burden that students are facing. We hope what we're doing is building the next generation of learning tools and also reducing their cost ultimately, because there will be, I believe there will be some textbooks that we can actually either augment or replace. And there are some textbooks I still use in my class because there's a certain level of depth of information that I need them to get. These apps were not meant to do that. These apps were meant to create lots of visual media to help assist with learning. So I hope everybody has a great weekend.